About optimal medical therapy. When we think about treating coronary artery disease, we often picture stents, angioplasty, or bypass surgery, the high-tech, dramatic interventions. But here is the most interesting point. Optimal medical therapy can be just as effective as minimum as some invasive procedures in preventing heart attacks and improving survival. Let's look at what that really means. OMT, optimal medical therapy, isn't just, pills. It's a comprehensive, evidence-based approach that targets every aspect of the disease's process, from lipid control to platelet inhibition to blood pressure regulation and lifestyle. So, for example, COURAGE trial, COURAGE, it's abbreviation. COURAGE trial was a game changer. It showed that in patients with stable coronary artery disease, this optimal medical therapy shown was as effective as percutaneous coronary intervention in reducing death and myocardial infarction over long-term follow-up. In other words, good medical management can rival stents when used it, of course, properly. Actually, not only stents, as well as bypass surgery as well. So what's inside optimal medical therapy? Let's start with medications. So first of all, of course, it's antiplatelet agents, as usually aspirin. Next, statins. So actually, in case of stable coronary artery disease, is highly controversial. Statins is okay for unstable situations. Why? Not just to lower LDL, but to stabilize plaque and reduce inflammation. So-called pleiotrope effectives of statins. Next, AC inhibitors for endothelial protection and blood pressure control. King of medications in cardiology, beta blockers to reduce myocardial oxygen demand and prevent arrhythmias and prolong diastole. We remember Frank Starling rule, Frank Starling principle. Long diastole gives us good systole. Why? Because blood supply to our myocardium is only and only in diastole, not in systole. It's exemption. No exception, exemption. So actually beta blockers gives us pattern like athlete's heart. And the principal point is a lifestyle optimization. Is a principle of the principle. Means smoking cessation, regular underlying exercise, of course, every day. Healthy diet, and we do not talk about cholesterol diets. It's nonsense. Healthy diet means good proteins, good lipids, and good carbs, not fast carbs. And stress control, if it's possible. This is the foundation of all therapy. So another fascinating fact, so even when revascularization is needed, no other options. Patients who receive optimal medical therapy first have better long-term outcomes. Yes, fewer recurrent events, improved quality of life, and lower mortality. So the take-home messages: drugs don't just complement procedures, they save lives. Actually, not drugs only, but lifestyle changes, healthy lifestyle. So the stent, yes, fixing the plumbing, but OMT fixes the disease, optimal medical therapy. If you master OMT, you master the art of treating coronary artery disease as its core, preventing the next event before it happens. So when we talk about the question is regular physical activity. What is this? It's a 5, 6, 7, 10,000 steps a day. More, better. I forgot the name of this trial, but we know that everyday walking 5,000 steps a day reduce total mortality, total, not only coronary artery disease mortality, total mortality for all cases, all case mortality, by 50%. If it's around 15,000 steps a day, around 70%. We have nothing compared to these numbers in our medical therapy, in our surgery, stent, etc. So lifestyle, walk every day. Smoking cessation, healthy diet, stress control, love your wife. This is the foundation of all therapy. Okay? Stay blessed.